So let's start off by talking about what is ADHD. Does it even exist? In one presentation I gave, the presenter started off by asking me, ADHD, is this even a real diagnosis? Is it myth or is it reality? And often I'll have families in the office saying that, I'm feeling my child's just typically developing. He has more energy than maybe other boys, maybe a little inattentive and distracted, but I think he's just typically developing. What is ADHD all about anyways? Well, ADHD is a neurobehavioral disorder. That means it's defined by the sort of clinical symptoms that you see, the behaviors that you see in children. Usually it presents in childhood, and this is important in that if I have an adolescent that comes in, or even a young adult who comes in thinking they might have ADHD, I'll often go back a little bit, look at the early childhood years, maybe when they were 6, 7 years old, and see if there were some symptoms or other teacher reports or parent concerns back then. If I have a young adult or older child, adolescent come in with ADHD complaints that have never had symptoms before, it might get me thinking a little bit about other diagnoses or other conditions that tend to come up at those ages. The ADHD core symptoms are inattention, distractibility, hyperactivity, and impulsivity. And something we'll talk about a little bit later in the presentation are the different subtypes of ADHD. Now you hear that I'm saying ADHD, attention deficit hyperactivity disorder. And this gets a little bit confusing for parents in that they'll often wonder, well, what's ADD then, attention deficit disorder? The reason this is so confusing is that in the Diagnostic and Statistical Manual, the book we use to help define what is ADHD, it's all put under the category of ADHD with the two subtypes, the inattentive subtype, which most families know as ADD or attention deficit disorder, and then ADHD hyperactive and impulsive subtype, which families more traditionally know as ADHD. There's also a combined subtype. That's where you have symptoms both of the inattention distractibility and the hyperactivity and impulsivity. The symptoms have to be appropriate for the child's age. So for example, a lot of our diagnostic criteria, when applied to, say, a 7 or 8-year-old, wouldn't be useful in a child who's much younger. So for example, where we might expect a 4 or 5-year-old child to typically developing to have some sort of inattention and distractibility, it becomes developmentally inappropriate for those children to behave in a similar way as they get older. So one of the criteria for diagnosing ADHD is the symptoms are inappropriate for the child's age. Another important criteria in figuring out if a child has ADHD or if they're just typically developing is how it impacts their function. And this is a question that comes up with almost every family in the office where parents will say, I think they're a little hyperactive. They're just like me when I was a kid. But when do we actually give them a diagnosis? Well, it's when it starts causing functional problems. So this is where I'll get reports from parents where the teachers will say, I think they could learn so much better if they could sit still or if they would pay attention. Or mothers saying, I feel like I can't leave the house at times because when I go to the store, my child's hyperactivity and impulsivity may be unsafe, might be running in traffic in the parking lot. The impulsivity and explosive behavior may cause problems even going to the grocery store. I can't have play dates with friends because of my child's behavior. So when you start seeing these functional problems, that's when it crosses the line from being, is this just typical boy behavior versus do we start thinking a little bit about a diagnosis? And then finally, this ADHD is a chronic condition with symptoms lasting more than 6 months. I like to have a history of 2 years of ADHD symptoms before making a diagnosis. It's a chronic condition. And this helps in determining if this is just a reaction to some sort of changes or an adjustment disorder when a family moves or there's some social stressors, and that we look for a pattern of behavior of ADHD symptoms for 6 months or even better, like 2 years. So who gets ADHD? Well, a lot of children. Big studies that are done, somewhere between 3 and 5% of children meet diagnostic criteria for ADHD. When I talk to the school nurses and psychologists in the area, it's more 1 in 8 children are receiving some sort of services or medication directed towards ADHD symptoms. It's more common in boys, 3 to 6 times more common, especially for the hyperactive and impulsive subtype. Once puberty is reached, the ratio becomes a bit closer. Girls tend to have the more inattentive and distractible subtype of ADHD. So a very common condition, and yes, it's a real disorder. And to answer the question, myth or reality, it's reality. And the families that I deal with in the office have very real struggles and problems, and often with appropriate treatment, not necessarily medications, children respond well and have more typical sort of interactions and experiences in the classroom and home. So in the next section, we'll be talking about some of the causes for ADHD.